I think the first example we can use is our C. diff rates. C. diff is an infection that is considered hospital acquired in the right time frame in a hospital. Back 9-10 years ago for us, it was one of our highest rates of a hospital acquired infection. Really, we measured it, we reported it, we were transparent with our performance and saw pretty dramatic improvements over time. We've used that process to follow for all of our other hospital acquired infections.
The harm prevention work was really prioritized due to the fact that harms just fundamentally disrupt care in all kinds of ways.
So for us, ensuring alignment really meant making sure that frontline staff were present from the beginning, and we've been continuing to redevelop that process along the way. If the alignment wasn't exactly what we wanted it to be, then we would undergo another PDSA, ensure that we involved the right frontline team member, asked the right questions, developed the right processes for improvement, and ensured that there was engagement from the beginning to the end in terms of the entire process.
The word harms in healthcare is what can we do before it hits the patient? And so instituting in our entire organization zero harms rounds, it really allowed us to see the almost errors without them truly touching a patient. It empowered our staff to speak up when something's not right, but also to pause when we need to take just another moment.
One of the strategies that has really helped transparency is the Good Catch Award program. So several years ago, we did marketed education with the organization as a whole, rolling out our Good Catch Award program. Our Good Catch reports have increased exponentially. We've been able to fix processes, we've been able to mitigate harm just by creating that safe space for staff to be able to report either errors that have occurred or situations where they've noticed that the potential for error exists.
We have a just culture here, and so it's not punitive, it's really trying to get to why we did what we did and what could we do better and what ideas do they have to bring to the table to provide better care for our patients.
The harm collaboratives are very robust multidisciplinary teams. It fosters ideas, it fosters decision making, but it also brings the best and the brightest around the table to be able to solve whichever harm it is.
Teams have been able to go through a journey of learning how to win. Every month, reviewing the data, finding ways through the stratification of the data, the leading indicators. Then when those collaboratives start to see that improvement, which they have, then that momentum just builds. So now they're winning together as a team.
Our organization really empowers us to lead harm rounds. They empower us to make a difference. They empower us to bring our ideas to them on how we can prevent them. And it also don't only empower the nurse leaders, we empower our team, our frontline staff. They are the ones out there 24/7 with the patients every day. We empower them to find different initiatives to help make a difference in our patient experience.
Long-term success for us is eventually getting to that ultimate goal of zero. Zero preventable harm is what we have set as nirvana for us, and that really means is that we're going to be taking care of patients each and every day, and nothing that could happen to them does happen to them, and that they know that they're taking the best care of the patients that they possibly can.